Alrighty, we are recording, so just to let everybody know, and let me get to the logistics real quick. So thanks everybody for joining. It's UNC Health's media briefing, and today our medical experts will discuss mental well-being in the general population. We did talk about healthcare workers previously, so now we're going to talk about the general population through a long quarantine and a gradual return to normalcy as we enter phase 2. Just to let everybody know, we will post an unedited copy of the full briefing on YouTube, and also we'll put that on Dropbox after the call. Now that we have the full version of Zoom, you can record yourself if you want to record a file onto your hard drive. And to do that, if you want to record the call directly from Zoom, there is a record button at the bottom of the Zoom panel. If you click on that button, I'll be able to authorize your direct recording. I already did the authorization for folks that got in early, so you should be able to do it. If you can't, please send me a chat message, and I will go in on your participant profile and make that available to you. So just let me know during the call if that's not working for you, or if you do wish to use this. And then an audio file can be emailed to radio stations and anybody that wishes to use that just for note-taking purposes. Several folks do that as well. So I will now turn it over to my colleague, Alan Wolf, and Alan will introduce today's UNC Health experts. Alan?
Thanks, Phil. Hey, everybody. Thanks for joining us. Our experts are Dr. Samantha Meltzer-Brody, Chair of the Department of Psychiatry at the UNC School of Medicine. Dr. Meltzer-Brody is passionate about helping all of us cope with stress and trauma during the pandemic, especially health workers. She leads a team that is expanding resources available to support health workers during this crisis, including the recently launched UNC Healing Heroes Helpline. Dr. Bradley Gaines is a professor and the division head of global mental health in the Department of Psychiatry at UNC. He focuses his clinical and research efforts on treatment-resistant depression. Thank you both for joining us today. Dr. Meltzer-Brody, do you want to start off with a few opening remarks?
Sure. So thank you for the opportunity to join you today and talk about the well-being of the general population during the COVID-19 pandemic. For all of us, the last few months have been unprecedented, and we are fully appreciating the increasing impact of the quarantine and the ongoing crisis for everyone. It is impacting families in many different ways: economic impacts, social isolation, families directly affected by COVID, uncertainties of what happens next. Will kids go to school? There remains so much complexity and uncertainty, and that many people are struggling. We know from a report yesterday in the Washington Post that the Census Bureau is seeing extremely high levels of anxiety and depression being reported in the general population. And this is something we're very concerned about at UNC and in the Department of Psychiatry. How are we going to respond effectively to take care of the population seeking care? And what are things we can all be doing to try and minimize the impact?
Dr. Gaines, would you like to make a couple opening remarks?
I'm sure. Thanks. First, thanks everyone for having Dr. Meltzer-Brody and I on. This is certainly something that we're, quite interested in, and glad that others are interested in too, because as she mentioned, the response that folks have, whether it's through anxiety or whether it's through depressive symptoms or whether it's through overuse of substances or alcohol, or the kind of underactivity and other things that usually bring people joy, is something that's concerning all of us, and we're happy to provide whatever information we can today to help people kind of understand maybe what the do's are and maybe some of what the don'ts are in the next couple months.
Great. And so we'd like to use as much of our time as we can for media questions. So there's really not a good way to do this other than just having folks step right up. So if you're with the media and you have questions, please jump right in.
I can start. This is Anna Rivera with ABC 11. So right now, we're in this weird transition where things are starting to open up, and it's almost as if there's a lot of fear. What is the message to people as we start this reopening process? And there's obviously a want to get out of the house and be around other people, but there's also that fear.
Well, I think it's a great question. And we're seeing a range of responses from people who are fearful and don't want to leave the house at all to people that are in large crowded spaces doing the opposite of what public health guidelines would recommend. And I think really taking a thoughtful and cautious approach. The COVID pandemic is going to be simmering along for a while. It has not gone away. The reopening does not mean it has gone away. On the other hand, people cannot be locked in their house for the next couple years. And so we all have to figure out what is going to be the middle ground. How do we manage to go about our lives in a way that preserves our mental health, which is really important, while ensuring we are doing everything we can to protect our safety and that of our neighbors and colleagues. And it's not a simple answer. I'll pause there and let my terrific colleague Brad comment on, what are we seeing, what are we understanding as what are appropriate safety guidelines to follow that allow us to exist and live our lives, while at the same time not being in denial or ignoring the reality of what we're facing.
Thanks, Samantha. I mean, I think an important thing to keep in mind is really there are two main factors that are affecting someone's risk of contracting COVID. That is kind of the level of exposure to the virus, as well as how much time they've spent during that time. Now, what we're coming away from now is really a complete on-off kind of thing. There was complete shelter versus not, and that's a pretty stark contrast. I think the challenging part is going to be how do we start to realize that there actually is there's more of a middle ground. It's not just all or none. So that as we're trying to get more comfortable with the notion of being outside, I think the most important things are to realize that there are particular areas that are of higher risk or lower risk. For example, just getting outside, whether it's walking in your neighborhood or walking in other areas where there's actually a large amount of area outside, that's quite a low risk. That's quite a low risk area. There's not a whole lot of concern there. And then, again, in terms of how close you are to some kind of exposure, there are certain kinds of exposures that are riskier and others that are not. We're finding out that that maybe touch surfaces are less concerning than we thought that they were, but there still, is a concern about, about the exposure through droplets through the air or through folks that might be coughing or sneezing. So I think as people are starting to realize that, yes, there is this middle ground between all or none, I think maybe a first step to take is to get more comfortable going out in public spaces and to kind of keep moving, because those tend to be pretty kind of low risk situations.
Additional media questions, please just jump right in. Well, while we're waiting for possibly some more media questions, I got one. Oh, go ahead. Go, jump on in.
Hey, I'll pop in real quick. This is Elle from 97.9 The Hill. My question is kind of just, even if the general public is finding this middle ground and, maintaining a healthy balance, a lot of people dealing with depression and especially anxiety are still going to be feeling these effects for a very long time, even if they're, trying to find some semblance of normalcy. What kind of advice would you give to them, or, treatment, as this is something that we see being very much a marathon, not a sprint?
It's a great question. I think the most important thing is if someone is feeling that anxiety or mood symptoms are interfering with their ability to enjoy things in their life, even in the background of the pandemic, they really need to get help. And so we've been dealing this for a few months. We're going to be dealing with it for quite a ways to go. And one of the things that's come out of the pandemic is that telepsychiatry and support emotional help is now more widely available than it ever was before. So the insurance companies are paying for people to use telepsychiatry. That was not the case prior to the pandemic. So that is one of the interesting innovations that the pandemic has brought to us. So that means you can be in your home and you can get mental health care widely via telepsychiatry. So we really encourage people to reach out for support. There are many different types of therapy. There's different support therapy, cognitive behavioral therapy, other forms of therapy that are evidence-based and can be helpful. There's pharmacologic treatments that can help if people are having full-on panic attacks, if they're having symptoms of PTSD or post-traumatic stress disorder. So we're going to see a range of things from people who have anxiety that's mildly impairing to people that have found this experience traumatic, absolutely traumatic. And that perception of whether it's been traumatic or not will have to do with someone's previous history. Do they have a previous history of trauma? What has been the impact? It's really important, though, that people get help. The last thing we want is for someone to be self-medicating by drinking themselves to death at home. We know that alcohol sales are up 60%. So people are going to find one way or another to cope, and it can be either constructive or it can be really maladaptive. And so we don't want people to take out their stress by having a lot of conflict in the household or drinking excessively or using other drugs and alcohol. We don't want people suffering in silence. And so we really will encourage people to reach out. There are a vast array of mental health resources available for anyone listening to this, and they can be accessible now from your house, which is a very exciting advance that can make a huge difference for people.
And Elle, the only thing I think I would add to that would be just a couple things. One is, in addition to what Samantha is mentioning, there are lots of things that folks can do for themselves. Those things consist of things like identifying, now that things have been knocked so much from the normal, that people should actually take some time to figure out what are the most meaningful things and the most really, kind of normal, refreshing things to them, and then make sure that they do it. It might be spending time with children. It might be spending time with other family members. It might be cooking. It might be making sure that they exercise. But people need to kind of identify what's most meaningful and really healthful for them, and then to start to try to carve out some times to do those things. I've heard lots of folks talk about the challenges of the pandemic, but a lot of folks have also talked about how it's kind of given them a sense, it's given them an opportunity to kind of reconsider what is most important and how they can more consistently work that into their everyday lives. And then I think the only other observation I would have is to maybe take a bit of a page from some of the cognitive behavioral therapy that Dr. Meltzer-Brody had mentioned to us as an opportunity. One of the key steps there is something called gradual desensitization. And again, it doesn't necessarily have to be an all or none thing. You can slowly kind of work yourself as you're going out of the house. You get yourself to a point where you're pretty uncomfortable, and maybe that's as far as you go, and you start to begin to let yourself find ways to relax in that time. And then the next time, maybe a little further out, but it will take time over this marathon to start getting used to returns to normal. And they don't have to be all at once. They really can be, kind of small steps as people get used to, moving a little bit further each time.
There's one thing I wanted to add as well. One of the things we're most concerned about are people that are feeling that life is now not worth living or having suicidal thoughts. And if someone's experiencing overwhelming anxiety or feeling hopeless or having thoughts life is not worth living, that is a trigger that they need to get help. And we want people to reach out to a suicide prevention hotline, or they see that as an indication that they really need to get some professional intervention. It can take a wide variety of different methods to get intervention, but that they see that as a signal to reach out and get help. We are seeing increased hopelessness in some of our young people, and many people are concerned, what's going to happen with my life? What's going to happen with the economy? We are very concerned about that, and we want anyone listening, if they're concerned about their kids, their adolescents, their young adults, that they are taking that extremely seriously and making sure they are reaching out and getting help and making sure their loved one or family member is getting some intervention.
Yeah, Samantha's point there is really important. You know, it's not just looking at yourself, but it's also looking at those around you that you care a great deal about. You know, one of the great risks and concerns about what folks may be doing in the pandemic is isolating themselves a lot and actually not really cutting themselves off from others. So, you know, whether it's not letting themselves isolate quite as much, or whether it's, you know, looking at those around you who you may see isolating and trying to kind of help them realize, you know, there are other people around, there are ways to reach out, whether it's a suicide hotline or talking to a close friend you haven't spoken to for a while. There are, you know, there are lots of ways that all of us can kind of help keep an eye on ourselves and those around us.
If I may, can I do a quick follow-up question?
Sure, go right ahead.
Sure. So kind of speaking, you know, to the original point that was made about seeking help if you need it and all the different teletherapy and telepsychiatry options that there are, you know, I think a lot of people find that the hardest part for those that are experiencing depression or anxiety, especially while in isolation right now, is to be making that first step, you know, and to be able to find the resources, especially when you may be feeling in a hopeless state. So where would you even, excuse me, for people that are looking for a place to start that may not have even experienced anything like this before, how would you help, you know, what advice would you give to help guide them through that process of just beginning?
A great question. And we've put together at UNC a very detailed list of resources. So you can look at a couple different places. I would point you to our UNC Department of Psychiatry website. On the very front page, UNC Department of Psychiatry website, it provides information on how to connect with our outpatient program, which both has therapists, medication management, everything in between for a range of mental health concerns. And this is largely being done by telepsychiatry right now. It also has other information on resources. And then the UNC Health Well Being Program also has a very large list of resources available. And I'm sure we can provide those links to you. In both cases, we provide both what we offer at UNC and then what is being offered nationally and across the state. There are many, many things, both in the community, certainly at UNC, national hotlines, other things that are available. And I think as a start, that's where I would start, because it can be overwhelming to know where to start. I think we really have to tackle the stigma piece, though. People have to know they are not alone in this, and it's not that they're doing something wrong, and it's not that they're not strong enough. One of the things we can all do for each other is just acknowledge this is extremely difficult. How are you doing? Are you feeling so scared that you feel like you can't go out and enjoy things? Or even if you try and sit outside with friends, are you able to enjoy that? Checking in with family members. People may feel ashamed to say how they're doing. Checking in and asking our young people, how are you doing? How are you feeling? What do you think about the future? Making people aware that they are not alone and that it can have felt very traumatic and that what they're experiencing puts them in very good company. And there's something importantly we can do about it. So opening up those lines of conversation and communication is vital.
Additional media questions. Anna, Lou, like you're asking her a question.
Yeah, so this whole pandemic has also created a lot of not more expectations, but different expectations for parents, especially, who have gone from just working outside of the home to now working in the home, taking care of kids and being a teacher. And I feel like there is a lot of feelings of, am I doing a good job? Are my kids getting what they need, in a whole different sense than what it was previously? What do you say to parents right now who are struggling, and what can they do as we now head into the summer months and we've been in quarantine and they've missed so much school?
It's a great question. I would say that we have to be really kind to ourselves and to each other. And first off, we have to reset expectations. It is impossible to be working full-time. It looks like you're working full-time from your car. You know, like working from your car while you're trying to, you know, homeschool your kids or assist them with, you know, online second grade. And taking care of elderly parents and everything else. And the first thing is to just acknowledge, like, it's not going to be what you want it to be, because that's actually impossible. And I think we're going after good enough. Is it going to be good enough? We will all get beyond this. And whether they had the optimal educational experience during the next few months, they will move beyond it. It will not be a permanent blip. I think what we have to ensure against is that people don't get stuck in a place where they feel hopeless, or they feel paralyzed, or they start feeling so anxious and overwhelmed they can't enjoy their lives. So we have to start with expectations about good enough, people really thinking that they are not going to be able to do everything they want, but what's going to be good enough today, and to be very kind to themselves and others around them.
And there's no playbook for what all of us are doing right now. I mean, actually, all of us probably have a different playbook that's going to work. So I think really the general things that I would think about is, first off, if it's, your kids or other family members, first you want to listen and get an idea really of what their needs are and what they need and what they want. We can't assume that we absolutely know exactly what the person needs. We have to kind of listen to them, consider, and then try something. And then you try it and you figure out whether it works. The playbook is likely going to change. The plays that maybe worked a month or two ago may not be working, this week or a month from now. So we're going to all of us are continuing to reconsider, reassess, listening, see what people's needs are. Samantha says, be kind to those folks and be kind to ourselves, because we're all figuring out the best ways to kind of try to get through all this together.
A question we got via chat from Rose Hoban, North Carolina Health News. Rose is asking, what's the prognostication for continued reimbursement for telehealth? Do we think this is a fundamental shift for this type of treatment, that it will be covered? Or do we think once the pandemic's over, we'll be going back to the way it was before?
I sure hope the genie's out of the bottle and it will continue to be covered. And we will have to wait and see. But I think the uptake has been so widespread, and I would find it hard to believe it would completely be stuffed back in the bottle. I think there's likely to be an evolution of what is covered and how and when. But I think that it is so accessible, and mental health and telehealth, telepsychiatry in particular, is very, very well suited, and our ability to increase access and reach people, I think, is amazing right now, and so important. So Brad, what do you think?
I have the same hopes that you do. I think one of the things that hopefully will absolutely not go back in the bottle is that reach part. I mean, we have 100 counties in North Carolina. A large, substantial part of it is rural, and this is actually opening up opportunities for them to get mental health care in ways that never were possible before. When we're living in Raleigh, Durham, Chapel Hill, and the Triad, and in the Charlotte-Mecklenburg area, there's a lot of density there. That's kind of one thing. But the opportunity, I think, for folks who live outside of those large areas, and to realize what their need is and what the possibilities are, given how really impressively successful telehealth has been. I really hope that that's not a piece at all that can be shoved back in the bottle, because we've realized one of the things I think all of us have observed during the pandemic is how important access is, whether it's to general medical care that may be specifically COVID related, or whether it's to other types of care, including telemental health, that may have a lot to do with what some of the disparities in outcomes that we're seeing are. So I really think that this opportunity to reach just way beyond the large areas is something that we're able to maintain for perpetuity.
And the reality is that right now with telehealth, people who have jobs that are not forgiving, if you're an essential worker, you work in a place that is not kind with saying, I need to take the afternoon off to go to the doctor's appointment, and that your mental health provider appointment will cause you to miss an entire day of work to drive 3 hours and back. You could literally go sit in your car in a parking lot, wherever you work, and have your telepsych appointment at lunchtime. So the ability for people to get substance abuse treatment that way, substance abuse treatment is being managed by telepsychiatry, to be treated for things that you otherwise never would have been able to take care of, to get care earlier, which will then prevent worsening, is amazing right now. And I think that it would be in the best interest of all of us for this to continue. So that's our hope, and we're going to be working hard to advocate for that.
Another question is kind of shifting gears a little bit, but news about COVID's everywhere. Should we be taking a break from it somehow, trying to not think about it, or is it important to process everything that's out there and everything that's being constantly released?
No. I mean, different people have taken different approaches to that, but the analogy would be watching your blood pressure every minute of the day, all day. You kind of don't necessarily care what it is at 9:01 and 9:03 and 9:10 a.m. and then 9:37 and then 9:50. What we're concerned about, rather than that, specific blood pressure then, is really what the whole, course of your blood pressure is. So I think you're absolutely right that the way to reasonably do it is to take it in certain doses. I mean, you can have a really effective drug, and if you take it 12 times a day, it's likely going to make you pretty sick. Whereas if you take it once a day, or maybe it's a once a week medication, you can kind of decide what works best for you. But I really think finding the right way to dose is important. Every new headline that gets sent out by some organization every 30 minutes is not a good way to do it. You're a lot more interested in what the what that overall course of blood pressure is than you are in what happens every single second.
I think that people really have to figure out how they're going to resume their lives following what are safety guidelines. So ignoring everything and saying, I'm done with this and I'm going to pretend it never happened and I'm just going to do whatever I want to do and not do anything differently, that's not a good plan. Staying in your house and being glued to the news every minute is also a terrible plan. So it's the sweet spot. It's the live your life, follow the guidelines on how to prevent transmission and keep yourself and others safe, and then move forward in your life to the extent possible. Now, I say that knowing that for some people, their lives have dramatically changed if they've lost a job or they're impacted in other really significant ways, and that they just can't resume where they were. And so for those people, it's going to take a lot more effort to figure out, how am I going to navigate this? What are next steps? What additional supports do we need? But everyone needs to figure out how to, find a way to navigate that does not cause them to be constantly bombarded with updates, and to figure out what's going to be restorative, what's going to help them feel they can engage in their daily activities, what's going to help them feel good and have them feel that life is meaningful.
So we're almost out of time here. It's 10:29. Do we have any final questions from the media before we?
Hey, this is Helen Chickering from Asheville. I'm just interested in the impact of the pandemic on mental health care practices. If you can speak to at UNC and beyond, what it was like in the beginning of the coronavirus pandemic, what it's like now. Are you seeing more patients? Are they existing patients, returning patients? And also the impact on physicians. What are you hearing as you work to support physicians that are going to be in this for the long haul? Thanks.
Thank you. Yes, we are seeing an increase in referral. Our telepsychiatry business is extremely busy. People are reaching out. And the impact on physicians, we are seeing a lot of stress, a lot of people who are reaching out for help. We have worked very hard to decrease stigma, to provide services broadly at UNC. And there's both a state-run helpline, there's a UNC helpline, but the impact is real. So to quickly answer your question, yes and yes. Yes, we're seeing increased number of people reaching out for help. We know there's worsening mental health from community surveys, and the impact on physicians and other frontline healthcare providers is significant. And so for all these reasons, people have to be aware of this and make sure they're aware of the resources to address it.
Great. Well, thank you very much. We are out of time. If anyone has additional questions, they can email those either to Alan Wolf or myself. Thank you so much for joining us. Again, just a reminder, we will post unedited video of this on YouTube channel, and also we've got a Dropbox for folks if they need that, and we've got an audio file that we can email to you. So thank you everybody for joining us, and we'll be back in touch next week. Thanks so much. Thank you to our guests.
Thank you. Thanks. Bye-bye.
Take care all.